Hi, I'm Dr. Song from Omni Aesthetics, and today I'm here to talk about a really exciting skin tightening treatment called Thermitight. Now, Thermitight is what we like to refer to as an in-between treatment, and the reason that we like to call it in-between is because it is a little bit more aggressive than some of the non-invasive treatments that are out there, but it's not quite surgery, so you don't have the downtime and the type of complications that you can have with an actual surgical procedure. The Thermitight treatment uses radio frequency energy to heat the skin underneath, and we know that when we heat the skin to a certain temperature, the body senses that as an injury and sends signals for your skin to heal. And the primary way that your body heals is by producing new collagen and new skin. So when that happens, it causes a tightening and rejuvenation of the skin. So we use the Thermitight device to tighten skin by we make a little hole with a needle right here and back here. So usually it's just 3 holes. And if you want to tighten the neck area as well, sometimes we go in here and here too. But these are very tiny holes that will close up within a few days. And very rarely will it leave any mark. And unless you're prone to keloid scarring, there's very little risk of any type of visible scars after this procedure. Now, again, the way that it works is by creating new collagen. It tightens the skin, and we get a really nice tightening of the jawline, and we can get tightening of the skin under the chin. Those are the areas that are the most popular for this treatment, but we can use it in a lot of different areas. We use it for tightening skin under the arms, in the abdominal area, thighs, but again, the most popular treatment is the neck, under chin area, because that's where we're seeing it's most visible. The treatment itself does cause some swelling. We use a local anesthesia with lidocaine, and we inject it under the skin so that everything is numb, and then what we can do is sometimes we go in there and remove some fat. We do a little manual aspiration of the fat with a syringe and take some of that fat out. But if it's not a lot of fat, we can just use the device. The heat will actually melt some of that fat. Now, it does take some time to see the results, but most people do start seeing some results occur within a few weeks after the swelling goes down. And then it can take up to 4 months to see some really nice results. And then most people find continued improvement for up to a year. And then after that, it doesn't wear off like a Botox or filler treatment, but what happens is you just age naturally from there. So it's kind of like setting back the clock, and then maybe a few years. And then this is a treatment that can be repeated, and also it's a treatment that is great as to give an initial kickstart, and then if you wanted to touch up, that's when you can use some of the less aggressive treatments like the therapy, which is a great way to maintain it, or now we have new Fractora treatment, which helps to maintain this type of treatment. But again, this is a more aggressive treatment than most of the non-surgical treatment that's out there. Now let's talk about some of the complications with this type of treatment. As you know, with any treatment, whether it's non-invasive or surgical treatment, there are some risks that we have to be aware of before we undertake the treatment. Now, because this is a non-surgical treatment, it is done while you're awake, and we're using local anesthesia. So we eliminate the risk of general anesthesia right off the bat. So that's the biggest risk of any type of cosmetic treatment that requires surgery. If you're under general anesthesia, that puts you in a whole different category of risk associated with general anesthesia. Now, we're using what's called tumescent anesthesia, which consists of IV fluid with some lidocaine and epinephrine mixed in it. And we infuse this area. We use a little cannula to just kind of bathe the area underneath with that tumescent fluid, which will numb everything up so that you won't feel any pain when this is occurring, because it does get hot, and if we didn't numb it, it would be too hot for most people to tolerate. Now, anytime you do go underneath the skin, there's always risk of infection because bacteria can travel through. But again, because the entry sites are very small, there's no open wounds that infection can get into. So it's a much less riskier treatment in terms of infection than doing a surgical treatment. Now, the other risks are, again, as we mentioned, there is a small risk of getting a burn on the skin, which could consist of a blister, or it could actually sometimes cause a more significant burn. And we do have some very, very good ways to minimize that risk. And one is there is a temperature gauge at the tip of the catheter that we use, so we know exactly what temperature it is, so that we don't go near the range where you can actually cause a burn. And the other thing is really neat. If you look at the screen behind me here, this is a thermal camera that can actually tell us the temperature of the skin in real time. Now, when we're doing the treatment, we're very conscientious of the surface temperature, because if a burn occurs, it could be on the surface. So by using these two methods to control and monitor the temperature, we can really minimize the risk of any type of burn occurring. Now, some of the other risks, and this is actually something that's expected, we do expect some swelling. And if it's if we're doing a mild treatment, the swelling is very minimal and usually will go away in a couple of days. But if you do need some more aggressive skin tightening, we raise the temperature up a little bit higher, and with that you can get some more significant swelling, and the swelling can last a week or more. If there's fat, if there's considerable fat in the area, there's two ways that we can address the fat. One is just using the device to melt the fat, and the other thing that we can do to get even a better result is to actually aspirate some of that fat out. We use a little mini liposuction cannula to just kind of remove some of the fat in the area. Since we're there and it's numb anyway, it's real easy to do. When we do that, the swelling can last considerably longer. It could last a few weeks. And there is risk of bruising, and there is also risk of temporarily stunning a nerve. There's a nerve that here that can sometimes get stunned, either by the heat or by the manual trauma from the liposuction if we do that. And if that occurs, basically what happens is it affects the pulling down. So you might have one side that's a little bit more, doesn't go down, so it may be a little bit crooked. And when that happens, usually it's very temporary and will go away within a few days. But sometimes it could last a few weeks or more. But it pretty much always resolves. And if it looks like it's going to last a little bit longer, what we can do is we can easily address that by putting a little bit of Botox to even the sides out until everything heals up so that it doesn't look funny. But again, this is something that happens very rarely, but it is something that pretty much always resolves completely. And some of the other risks of these treatment, sometimes it may not come out perfectly even. We're all asymmetrical, so to begin with, so we try to make it more symmetrical by adjusting one side, treating one side more aggressively if we need to. But if it does come out a little uneven, we may need to repeat the treatment. Some people will respond better than others, and generally younger people will respond better than older people, but we have treated patients well into their upper 70s with some excellent results. If you are a smoker, your results are not going to be very good. And that's because it does rely on your own body's healing mechanism and collagen production, and if you're a smoker, your collagen production is just not going to be very good. So what we recommend is that if you are an active smoker, that you quit smoking for 6 months before doing this treatment, or any type of treatment, whether it's surgery, non-invasive treatment, this treatment, or even Botox or fillers. You're not going to respond as well if you're a smoker. And also smoking does age your skin prematurely, so it's a good idea to quit if you're going to be spending money to have this type of treatment. The results of this treatment is not going to be the same as having a surgical treatment, such as a facelift or a neck lift. But the advantage of this treatment over a surgical treatment is, one, you're not going to have the scars that you have with surgery. And also, when you're doing surgery, you're just kind of pulling the skin back and stretching it. So oftentimes, unless it's really done well, the surgical treatments do tend to be more obvious. Now this is because the skin tightening is occurring in all directions, this tends to look much more natural, and it won't give you that pull back look that that surgery can sometimes give you. And also because it is creating new collagen, it will make your skin look more robust and fuller than you would if you just stretch the skin back with surgery. So again, this treatment is called Thermitight. It's one of the most exciting new treatments out there for non-surgical skin tightening. My name is Dr. Song from Omni Aesthetics in Oakland, New Jersey, and thank you for watching. Risks and complications are possible with any procedure. Risks include, but are not limited to, infections, scarring, hyper or hypopigmentation, burns, lumps, unevenness, drooping, allergic reactions, medication toxicity, persistent pain, persistent numbness, and lack of desired results. Bruising and swelling are expected and usually resolve within a week, but they can sometimes last for weeks or more. Although most of these risks are rare, complications can occur and are sometimes permanent, even with non-invasive treatments. We strongly advise you carefully review your informed consent forms and discuss the risks and benefits and other options before undergoing cosmetic treatments. In the event of a serious complication, your doctor may need to refer you to another specialist or to the hospital. You should not undergo cosmetic treatments without proper health insurance coverage.